You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
So here we are. So like I said, I'm Catherine Schuster, and I'm the program director for the University of Louisville. I'm entering my second year being a program director, and I'm very excited to have this role and to share a program with all of you. So Louisville is located in Kentucky, and our main rehab hospital is Fraser Rehab Institute, which has been around for quite some time. And it is a 15-story building that has now 5 floors of inpatient rehab beds, in addition to clinics and other outpatient therapy locations. You can see the list of floors over there on the right. And actually this needs to be updated because we recently opened additional beds on the 3rd floor. So we are continuing to grow. In the past year, we treated a lot of stroke patients, brain injury patients, spinal cord injury patients, but also see really the gamut of all diagnoses. I am pediatric PM&R by training, and so there is a growing percentage of pediatric patients that we care for as well as we continue to grow that service line, although certainly not mandatory to love pediatrics. If you come here to join us, we will give you an excellent education either way. And so it is part of the University of Louisville, our sponsoring institution. I'll kind of, there's a lot of history in terms of who is in charge of what, but ultimately Fraser is now part of the university. And so that provides further support and learning opportunities for our residents to be an official collaborator with the university on the Fraser Rehab side. These are all the hospitals in Louisville. We rotate through the Veterans Hospital as well as community hospitals, the Children's Hospital, so that we see all of the diagnoses and pathologies that are available within Louisville. Within our rotations, any diagnoses that you want to take part in, we have available. We have inpatient spinal cord injury, brain injury, stroke, medically complex rehab, and pediatric as specific service lines within our inpatient rehab service, but also see really any patient who needs and benefits from inpatient rehab. And then also spend time rotating with on the community side with orthotics and prosthetics, receive plenty of EMGs, both in our outpatient clinics and then at the VA. Pain management, we rotate with pulmonary rehab, and so we feel very comfortable managing trachs and doing trach changes. We do admit ventilated patients for both pediatric and adult to Fraser, which is a unique skill set, something that our residents can feel comfortable taking care of. Musculoskeletal, sports medicine, and plenty of times for electives as well. One of the unique things that we have available within our program is that every Monday we have resident clinic, which is a continuity-based clinic. So there is a cohort of patients that are seen within resident clinic. And some of those patients, they get into that clinic because you were on service and they discharged while you were on service. And so they follow up with you, which I think is a really unique opportunity to see the spectrum from inpatient rehab and then continue for ongoing follow-up as an outpatient. Excuse me, all of those patients are staffed with an attending. There's 2 attendings that are there seeing those patients with you guys, but the plan, the workup, everything is yours. We also do EMGs, ultrasounds, and other procedures in that clinic. And so lots of time to build up your procedural skills and make those decisions in terms of dosing and where and how to do those procedures. We have a very robust didactic schedule that for the most part takes place on Wednesdays, but also time on Mondays and Fridays to make sure that we are covering the spectrum of all the things that are within PM&R. We also have the ability to have a dissection of upper and lower limbs, fresh tissue lab, so that we are practicing that with ultrasound. So we're doing injections on the fresh tissue as well as dissecting and working through those with our attendings to make sure that we feel with the anatomy. Working on increasing and improving our ultrasound exposure through different workshops. Grand rounds are twice a month in which residents participate, but then also faculty participate. We have journal club. I apologize. There's a big storm here in Louisville right now. And so my internet is kind of going in and out, and I just got a warning. So please let me know if all of a sudden like things go haywire. Case conferences, and one of the things that we do that I think is very unique is we work very closely with neurosurgery. And so we have a monthly conference in which PM&R neurosurgery and occasionally anesthesia pain, depending on what the case is, will join together and talk about different approaches to a case, which I think is a really good learning opportunity that allows our residents to see the same case from different perspectives. Lots of other opportunities just in terms of things that are available within Louisville, both for electives and then just different volunteer opportunities. And so that's a really cool thing that our residents are able to take part in. So they're seeing kind of the gamut of things that are available and things that our patients experience and things that our patients need and how we can best improve their function and quality of life. Our residents all take the PM&R self-assessment exam as well as the EMG exam. And then we offer yearly mock orals to prepare everyone for oral boards. All residents have the ability to attend one conference per year. We encourage them to attend the AAPM&R at least once, and then also offer board review. Part of that expense is paid for our PGY4s so that they can get additional time studying for boards. Call is shared between all residents. We are working our way into a full complement of 4 residents each year. And so these numbers will change a little bit once we have our full complement of 12 residents. And I say that because we increased our complement last year. And so we from 3 to 4. And so as we each year we are recruiting for 4 residents, but we still have classes with 3 because that was before the complement was increased. Home call during the week is on the evenings. And then on the weekend, you come in and round with an attending on Saturday and Sunday. And the holidays are divided evenly between the PGY 2s and 3s. Derby is considered a holiday here in Louisville. Admissions are done after hours with your phone and a laptop. And so it makes it relatively easy to take care of those. Our medical record is Cerner, if that means anything to anyone, if you've all used Cerner, and then we use Epic on the outpatient side. Moonlighting is permitted, and some of the things that people have done over the past, working in disability clinics, urgent care, doing cosmetic Botox, and some occupational medicine exposure. We participated in a lot of additional events, including wheelchair basketball, the Veterans Wheelchair Games, the Special Olympics MedFest, volunteering for the Louisville Ironman, and this has been going on for years, the high school football coverage, in which our residents are essentially the team physician for local high schools. So you're there on the sideline, taking part in those games and making, those initial decisions for triage and how to help these football players that are possibly injured during the game. And so that's a really cool opportunity to, be involved in the community and also expand our sports medicine skill set. Leave time, 20 days per year with 5 conference day. And we are relatively flexible in terms of trading call to accommodate things so that everyone is able to take the time away from work that they need. Our department sponsors $1,800 for conference attendance and other educational related things with the board review course, and portion of that is covered. We have free parking, doctor's lounge with free food. My office is always full of food. And if anyone wants to further look into the benefits provided by Louisville, there is the link. I would say overall, from a resident standpoint, the kind of benefits that you don't think about, insurance and disability and all of that stuff, is really very good. This is just a map showing where we are all from. The current residents are red stars, recent alumni are gold stars, and incoming residents are green stars, although this map doesn't extend all the way far enough to have one of our green stars, which is in Eastern Canada. So we have people coming from really all over. I am personally from Cincinnati, but I've been back here for 6 years now. And I have no intention of leaving. I love it here. Louisville's a wonderful place. Our graduates, this is our most recent graduates, Alex Kersker, Stephanie Green, and Josh Heath. Alex will be doing a sports medicine fellowship. Steph is doing peds, and Josh is joining us as faculty. We have 100% written board pass rate for the past 5 years. Our most recent cohort also passed oral boards. 17 of the last 27 graduates have gone on to specialty fellowships. And I think overall people are able to get the job, the fellowship, whatever it is that they want to do upon graduating from our program. This is a picture of all of us as faculty, and we work very closely with other departments, specifically neurosurgery. We share an not office space, but office space with neurosurgery. So if I have a question about neurosurgery, I can walk down the hall and find a neurosurgeon or a neurosurgery resident, to get my question answered. Anesthesiology, neurology, movement disorders, podiatry, which here in Louisville, podiatry does a lot of foot and ankle wound care. And so that's a really excellent learning experience for our residents that I think is very unique because of the strong podiatry presence that Louisville has. Pulmonary as well. As I said, we manage vents at Fraser. And so that's a great experience in working with our pulmonary faculty, or the university pulmonary faculty, I should say. And then we have attendings at the VA. And then, I would say overall, any community physician that our residents have approached with elective or any kind of question of, can I rotate with you? Can I do this? They've all been very welcome and excited to have our residents be part of their clinics and teach our residents and learn from what our residents have to offer. One of the, I think, biggest things outside of that exceptional learning experiences and rotations that we have is that we all truly get along and want to be together, want to do, what am I trying to say? We hang out together, we really look out for each other and do all sorts of fun things outside of work because we really kind of have become a Louisville family and we all are very supportive of one another. So this is just some of the things. Last year, they dressed up as Girl Scout troop and I believe came in second or third place. One year, the residents did dress up as faculty and they won the Halloween contest at Fraser. That was amazing. And so that is the end. So I'm going to stop sharing and I think I'm good on time. So if anyone has questions, some of my residents are here. They can answer those questions as well. And thank you all for having me. I really appreciate it.
Thank you very much. You have about 6 minutes and 30 seconds left.
And I apologize. My dogs and my children are making a lot of noise in the background. So I apologize if things are strange over here.
Yes, if you guys have questions, you can type in the chat box and I can pass it on to Dr. Schuster, or she can read it in the chat box as well. Looks like we have some questions coming up. Can you read those, Dr. Schuster, or would you like me to read it for you?
I can see them. So
okay, perfect.
What research opportunities are available for residents? So we actually, there is a research department within our larger department that their focus is a lot on spinal cord research, but they have all of the components in terms of biostats and people who are very familiar with bench research and then helping us move that into translational research. I think as our department has grown, we are more and more doing research that like clinical based research. We have a current faculty who's an MD, PhD, MPH, who is kind of our research guru, helping guide our residents and be involved in research. Do we have a resident wellness program? We really work hard to make sure that our residents and our faculty are feeling supported and loved and having their mental health and well-being looked out for. So we have a faculty who is our wellness champion. That's Dr. Nelson, and she is always on the lookout for things that we can do to help support our mind, body, and spirit. And then the University of Louisville is also excellent with those different opportunities. And then one of our residents is such an amazing champion of resident wellness and I'm very excited organizing our second annual resident retreat that I'm not going to say what it is because I think it's supposed to be a secret-ish and some of my residents are on here, but more to come because I got invited this year. I'm excited. Let's see. I think I missed some because these are coming, and I can put my email address at the bottom. So if anyone wants to send me a question that I didn't answer, just email it to me and I will get to it. My favorite thing about Louisville, the food. Louisville is like a foodie hot zone. It is one of the best kept secrets. It is, oh my gosh, any kind of food you can think of, it's amazing. So the food, and then just it's a small, big city. So everything that a big city has, Louisville has it, minus professional sports teams, but we get around that because everyone values college like professional. And so all of the arts and sciences and everything that a big city has without that kind of overwhelming big city feel. And everything is only about 20 minutes away. How friendly is Louisville residency with families? It's super friendly. Some residents have children, some don't, some have spouses, some don't. It really doesn't matter. We all just kind of hang out and absorb who's there. And it never is a thing. If you have kids, that's awesome. If you don't have kids, that's awesome. It's so super friendly and super affordable for families. Fellowship programs that Louisville offers. So we have a spinal cord injury fellowship through PM&R. There's an anesthesia pain and then a family medicine sports program, but we have had a number of our PM&R residents go through that. So getting the PM&R family medicine combined experience, I think has been really wonderful on both sides. I'm sorry if I'm talking fast, I'm trying to get through as many of these as I can. To help applicants get an intern year. So it's a separate application. So yes, it's a separate application. You have to apply to medicine, but we will reach out to medicine to say, hey, we have this student who's applying to us. He's applying to you. We're interviewing him. Can you add him to your list kind of thing? So not guaranteed, but we work very closely with them and their program director is delightful.
You have 2 minutes.
What does maternity leave look like during residency? The ABPMR just put out new rules. They went into effect July 1st. So I don't know what those look like because we haven't applied them yet. But we will do whatever we can to adjust rotations to make sure that people are getting the time off that they need and that the other residents are feeling that things are covered in a way that is, good for patient care, but also good for everyone's wellness. Have there been any changes to the program director? Can you email me and I will get back to you because that is too long to answer in 2 minutes. How open is the department to faculty? So for treating with OMT. So right now we do not have any attendings that are DOs. And so that limits the ability to do it officially and formally, but we are always learning from each other. And I know that some of my DO residents are, provide education and are doing that for the other residents. Do most graduates end up staying? Oh, no, Louisville sucks you in. No one ever wants to leave. So yes and no. People want to stay. And in light of COVID, too many or too little. Okay. I think I'm going to run out of time to answer the rest of these. And because I don't want to shortchange anyone, because these last 4 questions, I think warrant more than 30 seconds. So I'm getting cut off. And so if the last of you that I didn't answer your questions, just feel free to email me. If I type it in the chat, is that fine?
Yes, that would be fine. That's the end of your time. But great presentation. You can type the answers in the chat box if you like, and you can also provide your email and then answer individually. So whatever works best for you. Thank you.
Okay, I am putting it in there. Thank you so much, everyone. I really appreciate you all taking the time, and I look forward to everyone's journey.